Good morning, it's Tamika Chambers, and welcome to October 10th, 2024, another day to say that I am getting better and better at understanding the questions and what they're asking me. All right, so as you know, I encourage you to have something to write with, as well as something to write on with whomever you do your questions with, and also to state your rationale, because you want to see, am I thinking more like a nurse? All right, a female adult client with a history of chronic hyperparathyroidism admits to being non-compliant. Based on initial assessment findings, the nurse formulates the nursing diagnosis of risk for injury. To complete the nursing diagnosis statement for this client, which related to phrase should the nurse add? As you know, I encourage you to make this a treasure hunt. What kid does not like a treasure hunt to find the gold? And what you're doing is you're picking out the keywords. What do we have? I always tell you to include, yes, let's include the female adult, just to be on the safe side. Chronic hyperparathyroidism, the medical diagnosis. She's not compliant. Risk for injury, nursing diagnosis, and related to what phrase? So we're looking at the relationship between chronic hyperparathyroidism and why is she at risk for injury? That's what we're looking at here. All right, so is it going to be A, related to the risk for injury? Is it related to the bone demineralization resulting in pathologic fractures? Or B, related to exhaustion secondary to an accelerated metabolic rate? Or C, related to edema and dry skin secondary to fluid infiltration into the interstitial spaces? Or D, related to tetany secondary to a decreased serum calcium level? Go ahead and pause the video and write your answer as well as your rationale. Think about it, say it, put it in the comments, whatever you want to do. Again, am I thinking more like a nurse? I'm getting there, right? So when we think about this, if you look at the word hyperparathyroidism, what does that mean? That means that they're producing too much parathyroid hormone. That is a condition. As you know, the parathyroid gland is in the neck, and it helps to regulate our blood and our bone calcium levels, right, through PTH, that hormone. And so they have too much of it. And as you know, anything can cause that. Tumor typically, is it benign growth, etc. But what's happening often in that situation, here's the link, is that blood calcium levels are increased. And one of the reasons that happens is that we have calcium being pulled from the bones. If we look at D, related to tetany, tetany occurs with what? Is it hypercalcemia or hypo? It's hypo. Related to edema and dry skin, number C, to fluid infiltration. They get edema and dry skin with hypothyroidism. So remember, if the organs are similar, they could throw in, like with hyper and hypo, you're looking at hypo symptoms, but they'll throw in hyperglycemia symptoms. All right, related to exhaustion, no, it doesn't increase metabolic rate, but they get bone demineralization because the parathyroid hormones is pulling calcium from the bone. So here you go. Here's your rationale. It's a nurse's lab question. Remember that get on a treasure hunt. Make it a treasure hunt. One of my clients said that. She said that's all she thought about was a treasure hunt. Make it fun. That's how you lessen the intimidation of the NCLEX. That's a tip for you today. So I hope you have a fantastic day. As you know, I do tutor NCLEX graduates to pass their exam, and I also have a course out, the NCLEX mindset, and it's about changing your mindset about the NCLEX and giving you those tools, tips, and strategies to help you be successful, not just in passing your NCLEX, but in becoming a great nurse. I'll talk to you guys soon.